Hi, everyone. Welcome back to the RAS, ACS, and Behind the Knife Journalcast on landmark papers in surgery. I'm Athena Yoham, a general surgery resident from the University of Miami Jackson Health System, and I will be briefly reviewing the landmark paper, Wait and See Policy or Laparoscopic Cholecystectomy after Endoscopic Sphincterotomy for Bile Duct Stones, a randomized trial. The aim in this study was to assess whether a wait and see policy is justified. Patients with common bile duct stones that do not pass on their own generally require endoscopic stone retrieval with possible sphincterotomy. Laparoscopic cholecystectomy is indicated in patients with concomitant gallbladder stones to prevent complications. Several retrospective studies have shown that between 4 and 12% of patients that do not have laparoscopic cholecystectomy end up with biliary complications. And this was a prospective randomized multi-center trial. There were 120 patients who underwent endoscopic sphincterotomy and stone extraction with proven gallbladder stones were included. The patients' ages ranged from 18 to 80 years old. Patients were randomly allocated to either the wait and see or the laparoscopic cholecystectomy group within 6 weeks. 12 patients were lost to follow up almost immediately. The primary outcome was recurrence of at least one biliary related event within the 2-year follow up, and the secondary outcome was complications of cholecystectomy and quality of life. Of the 59 patients allocated to the wait and see, 27 patients, or 47%, had recurrent biliary symptoms, compared to only one of 49 patients after laparoscopic cholecystectomy, a difference which was significant. 22 out of 27 patients, or 81%, with recurrent symptoms underwent cholecystectomy, mainly for biliary pain or acute cholecystitis. Conversion rate to open surgery was 55% in patients allocated to the wait and see who underwent cholecystectomy, compared to 23% in those who were allocated to the laparoscopic cholecystectomy group. Morbidity was 32% versus 14%. And the median hospital stay for patients in the wait and see group was 9 days versus lap chole group, which was 7 days. In conclusion, a wait and see policy after endoscopic sphincterotomy in combined cholecystodocholithiasis cannot be recommended as a standard treatment, since 47% of expectantly managed patients developed at least one recurrent biliary event and 37 needed cholecystectomy. In the wait and see patients who underwent cholecystectomy, almost all complications arose in those whom the laparoscopic procedure was converted perioperatively to open cholecystectomy. 6 of 7 complications. Again, thank you guys so much for listening. My name is Athena Yoham. I'm a general surgery resident at the University of Miami Jackson Health System. If you guys have any questions, comments, suggestions, feel free to email me. My email is athena.yoham@jhsmiami.org. I also have a Twitter. Feel free to follow me at my hashtag at Athena Yoham. Don't forget to review this content this week in SCORE module on benign biliary obstruction. Thanks again for listening.